So we're going to talk about a common issue that people have being pain in the front of their knee or anterior knee pain. This could be down below my patella, it could be atop of my kneecap. Sometimes people even get pain that's out to the side. So as long as the pain is in somewhere on the front side of the knee, whether it's on the inside or the outside or directly in the middle, typically there is some common ground with muscular issues that are feeding into that. Not saying that the muscle is, the only thing that could be the problem, but usually if you have pain here, tightness in the front of your thigh or quad is going to contribute to putting pressure on that painful site, or maybe irritating something here caused that muscle to tighten, and now that's also going to feed into making that pain worse. So with pain in the front of the knee, we're going to talk about a couple contributing factors and maybe some things that you can begin to do to alleviate that pain. First off, we're going to talk about the way that you use your knee. So you see a lot of people, whenever they squat down, when they get out of a chair, when they go up a step, that knee always wants to go over the toe because we're always moving forward to some extent. As soon as my weight shifts to the front of my foot, I have more pressure on the front of my knee. Versus if my weight is on my heel, there's less pressure here, and now I'm engaging a little bit more of my hamstring and my glutes to help me through that motion. So I have a lot of people that even when they go to get out of a chair, right? You see a lot of different variations of this, but for the most part, you see most people when they stand up, their knees come over their toes and they're pushing more through their toes, which makes them use a lot of their quads and not very much of the back of their leg. So little things throughout the day help take pressure off that knee. One being just trying to drive a little bit more through my heels as I get out of the chair, as I go to step up. Not that stairs are typically this high, but same thing. Rather than stepping up by putting a lot of weight on the toe, if I just think about pushing a little bit more through my heel, almost my head going straight up instead of forward as much, will take some pressure off the front of that knee. Now, as far as things that you can do to start to minimize that pressure, a big one is going to be something that loosens up or stretches your quad. So looking at things that are more pressure on your knee versus less pressure, typically if we start lying down or sitting, now there isn't at least weight bearing on our knee that can put as much compression on it. So the first thing I'm going to show you is going to be laying down on my back in a bridge position. So as I lie down here, the big thing I want to start off with is I want to make sure I keep some tension in my stomach so that my lower back just doesn't arch and put pressure on my back. And then usually I'll have people try and bend their knees as much as they can comfortably. So if I'm able to, I will take my heels as close to my butt as I can. I start off with a little tension in my stomach, flattening my back, and then as I keep that tension and I raise up, driving through my heels, not only do I get some activation of my glute, but I get a stretch to the front of my thighs. And I get that stretch with no real pressure on my knee. Now, if this does cause some of that, I may have someone bend their knee a little less to start. But typically, the more they do it, they'll feel a stretch, and then they're able to bend their knees a little bit more. Okay, so this is one position where you're not standing, so there's not a whole lot of threat to agitating the knee, right? Another one is in a chair, where ideally I would have, a smoother surface, or be, right now I'll just take my shoe off and my sock, and I'll sit out towards the edge of the chair. Okay, now I'll start off sliding my foot out straight, and that usually isn't too much of a problem. And then I start trying to take my foot underneath the chair. Now as I do this, many people have an issue keeping their legs straight. I see people as they start to slide, this knee will cave in or cave out. I want to try and go as straight back as I can. And then as soon as I feel pain or tightness, I get back out of there. Same thing, very unlikely this would cause a lot of pain because I'm sitting, there's no real pressure on my knee. Now as this starts to loosen up, my heel can raise up off the floor, and I want to see as I can, trying to get my foot further and further under the chair, right? Once I can do that, and that doesn't seem to bother me, I can add a little bit of a quad stretch here by keeping tension in my stomach and leaning back. This should ideally pull through the front of the thigh, not put a lot of pressure on the knee. If there is pressure on the knee, then you're not ready to lean back. You need to start off with just the seated slide. So these are two positions that would start to take some pressure off the front of the knee with a couple light movements that don't have you in standing, so it's very unlikely that they're going to threaten or cause pain. But also with your daily activities, really thinking about keeping more pressure on the heel so that you get help from your hamstring and your glute to take some pressure off the muscles on the front side of your thigh.